Welcome to all my dears. With the case taking and physical examination, and after that we have to investigate the case whether it is a case of Crohn's disease or not. For that we have to investigate the status of our patient, and as a primary level we can do some blood analysis, investigation of Crohn's disease. With a blood analysis. Due to the various levels of pathology, our body cannot absorb the nutrients. Malabsorption is there. More than that, various cellular changes can be seen in patient with Crohn's disease. All these changes will affect the erythropoietic quality of our patient, and thereby usually our patient will be in a very severe or moderate level of anemia. That is why evaluation of hemoglobin plays important role. Usually our patient will have a very low hemoglobin level. And another tests are evaluation of a complete blood count. In acute phase, you can see there is elevation of TC, and as the pathology advances, the TC will be very low, and if there is infection, especially with the bacteria, there will be elevated levels of neutrophils, and if it is because of any viral contaminations, the lymphocytes will be very high, and something like that changes can be counted with the complete blood count analysis. And another test is ESR. As the pathology advances, you can see there is elevation of ESR. This ESR is not much specific with the Crohn's disease patient, and more than ESR we can have CRP test. CRP tests are more sensitive and specific than that of the specific than that of the ESR levels. So these are the usual tests, but these tests are not much specific. Okay, being a autoimmune one, there are some sensitive immune analysis can be done in patient with Crohn's disease. Number one test is evaluation of PANA, that is peripheral anti-nuclear antibody test. Peripheral anti-nuclear antibody test, and more than NPNA, that means NPNA. It is neutrophil specific peripheral nuclear antibody test. Then anti-SMA, that is anti-smooth muscle antibody test. Something like that immune test will give a sensitive or specific possibility of our patient with Crohn's disease. And after that, we can have some radiological test. In radiological analysis, contrast barium, either contrast barium male or barium enema can be used to reveal the degree of pathology, and contrast barium study of small or large bowel smear reveals loss of normal mucosal pattern with a segmental narrowing. That means a normal colon is supposed to be like this, but in patient with Crohn's disease, you can see a normal colon following a narrowed area, then with a normal area, something like that. As we mentioned earlier classes, a segmental narrowing can be seen in patient with Crohn's disease, and by doing barium enema. Barium enema shows the extent of disease with associated features such as strictures and pseudopolyps. Barium enema reveals the strictures and presence of pseudopolyps can be studied. And on endoscopical examinations, by doing an endoscopical examination, tiny aphthous ulcers or deep penetrating longitudinal ulcers. Such class of ulcers are known as serpentine ulcers. Serpentine ulcers or a cobblestone appearance of the mucosa of Crohn's patient is a very classic feature. And at the same time, you can see rectal sparing can be seen in most of the cases. So, while having with the endoscopical examination, number one, serpentine ulcers, then cobblestone appearance of mucosa, and number three, rectal sparing. That means rectum is not affected in most of the cases. So by doing endoscopical examinations, this can be seen. And the most common investigation made for Crohn's disease is colonoscopical examination. Colonoscopical. As you know, depending on the part of examination, esophagoscope, gastroscope, duodenoscope, something like that. Colonoscope, that means evaluation made for examining the colonic areas. So in colonoscopical examination, you can see skip areas. Skip areas are nothing but the areas of inflamed area alternate with the normal area. So the intervening normal areas alternate with the affected area. Along with that, skip areas, rectal sparing can be seen. Next is about the colonoscopical biopsy. Colonoscopical. At the time of colonoscopical examination, from suspected areas of colon, we can have the tissue bites, and thereby we can do the histopathological studies, that is colonoscopical biopsy. So in colonoscopical biopsy, near about 50% of patients with Crohn's disease will give presence of granulomas, especially in with 30 to 50% of the cases. So in biopsy, the presence of granulomas give a positive conclusion of the diagnosis of Crohn's disease. And at the same time, let me again remind you that presence of perianal disease or perianal abscess or perianal fissures are the features which favors the possible diagnosis of Crohn's disease other than the above mentioned investigations. So an intelligent evaluation plays great important role. And even after doing all those things, if you fail to, or if the doctors fail to get the sharp diagnosis, they may do with the, or they can have the diagnosis with the laparotomy exam. That means opening of the colon. So while doing the laparotomy examinations, you can see a beefy red terminal ileum. That means a very severe, very aggressive, very congested, very edemated, very friable. It is something like that, a piece of beef. That is why it is narrated as beefy red terminal ileum with boggy mesenteric fats and succulent mesenteric lymph nodes can be seen. So on laparotomy, if it is a case of, or a Crohn's disease patient may presented with a beefy red terminal ileum with boggy mesenteric fats and succulent mesenteric lymph nodes gives the diagnosis of Crohn's disease. Next, about the treatment and management of Crohn's disease, I think we can study it in the next class. Thank you.